In this session, we will be hearing from our international colleagues from Care Opinion UK and Scotland as they share with us how relational feedback is making a difference to the safety of culture of care in the UK and bringing staff along the journey. As many of you may be aware, Care Opinion UK has been going for over 18 years, and it's really seeing how the feedback data is supporting safer care and happier teams. And I have the pleasure of introducing, as our first presenter today, the co-founder of Care Opinion and CEO for Care Opinion UK, Dr. James Munro. James has been at the helm of Care Opinion UK since 2014 and has a background in clinical medicine, public health, and health services research. James has spent much of the last 10 years overseeing the development of the Care Opinion platform, building the community of practice for relational feedback. And James will take us through the evidence and motivations for why people post feedback online and how this relates and to impact of staff, their morale, their confidence, pride, and the flow-on benefits for a culture of openness, learning, and improvement. A very warm welcome to you, James.
Thanks very much, Tina. Lovely to be with you this afternoon. Great to be connecting from a rather damp and cold UK. I hope it's nicer where you are. So let me share my slides. I've got a few slides to run through. We'll see how the time goes, but if you've got questions as we go along, if you'd like to pop them in the chat, that's fine. If I sort of spot a question I can answer as we're going, I will do. But I know we also have time for questions after Fraser's session, so feel free to pop any thoughts or comments or questions in the chat. And as Tina said, I'm going to talk a little bit about care opinion and culture, and indeed the notion of solidarity between patients, carers, and staff. So I'll talk a little bit about that. We'll touch on a few research findings, but there's a session a bit later on in the programme where I'm going to come back again and talk a bit more about research as a specific topic. But we'll mention a few researchy things as we go along now today. So we're talking about how people's feedback online in near real time can help healthcare get better. Can it help improve the quality and safety of care? That's what we're interested in this afternoon. And you may be an old hand with Care Opinion, so you may be very familiar with it. On the other hand, you might be quite new to seeing Care Opinion, seeing how it is. So just as a quick background, I'll let you know where we're up to in the UK. So this is our
Sorry,
mission
James.
statement.
Sorry to interrupt. We can see your second screen. So I just wanted to check in with you there that you knew that was appearing.
You're seeing the wrong screen, are you? Oh, you are.
We can see both.
Hopeless. Okay, let me do this again.
Thank you.
We need this one. Let's try this. Is that better?
Perfection. Thank you.
Yes. Okay. You can tell it's early in the morning. I haven't had enough coffee, have I? So here we are with the Care Opinion vision statement. We want people to be able to share their experiences of health and care in ways which are safe and simple and lead to learning and change. That's what we're interested in. We know these words in pink sound straightforward, but of course we know they're complex. People often don't share their experiences with healthcare staff because they're scared to, or they think it's pointless. Systems for giving feedback, for raising concerns, and indeed systems for giving positive feedback are often complex or non-existent. There are typically in most health systems, perhaps all health systems, there are no formalized methods for giving positive feedback, for expressions of gratitude, for example. They're not recorded. We rely on thank you cards and boxes of chocolates. So we don't get the most out of the gratitude that people want to share. And indeed, we know that in most health systems, certainly in the UK, we collect a vast amount of feedback data, but we don't use it for learning and change. So we may know a lot about, we may collect a lot of data on experiences, but is that leading to a safer, higher quality health system. So these are the interesting and important challenges that face all health systems, I think. And on Care Opinion, this is a recent screenshot. We're actually up to just over 600,000 stories on Care Opinion in the UK now, and around about 14,000 staff listening and responding to those stories. Response rates vary around the UK, but in Scotland and Northern Ireland, where Care Opinion is embedded at system level, response rates are around 96 or 97%. That's how it is. So people come along and they share their stories, and let's just look at a typical story and then think about why this has been shared and what the impact might be. So this story is called "We're So Grateful for the Effort, Time and Love That's Given to Our Family." And this is a story about somebody's child, somebody posting as a carer or a parent of a child who's saying, "Our son has pushed every single limit possible when it comes to his health over the last 4 years to a different level. In and out of surgery, medical devices in his abdomen. It's safe to say my son takes a lot of care and medical intervention. My son's very complex. And we're so grateful for the effort, time, and love that's given to our family, especially my son's sister, because it's not always easy having people in your house when you're getting ready for school. The CCN aren't just my son's nurses, they are our support network and the backbone, why we're able to live a life full of fun amongst the madness at home." So here's somebody giving some lovely positive feedback to a health service team. And here's the response from the lead nurse in that service. She says, "Thank you for your amazing feedback about the team. As lead nurse for the service, it really made me smile. As soon as I read your story, I phoned the team. It's created a real buzz in the team, which has rippled out across our service." And then she goes on to describe the various members of the team that have contributed, and she names them and talks about the impact of the care. So let's just pause for a second and think, well, why has this person shared this feedback and what impact has that had? And you can see even just from this single story that this is an expression of gratitude, a wish to acknowledge the difference that this team has made, a wish to encourage them, to let them know how important they are. And you can see that that has worked. Here's the member of staff responding and saying that she's shared it across the whole team. It's created a buzz, a ripple across the service. And this is an act of gratitude and an expression of solidarity with staff, which has, in this case, been shared widely for positive benefit. And we'll come on to some of the evidence around this. So let's broaden out a little bit and look at some of the research evidence on this question. Why do people post their feedback online in the first place? What are they trying to achieve? And when they do post feedback, are they successful in achieving their goals? So we have some evidence in this space from the research that's been published. This is an early paper which is a cross-sectional study of 1,000 adults in the UK. And this paper found that in the past year, about 42% of the population, the adult population of the UK, had read, and about 8% had shared online feedback about healthcare. Not just on Care Opinion, of course, through social media, blogs, and so on. But it's quite a percentage, and this is 5 years ago now. So I suspect this has probably gone up a bit. So we might imagine that perhaps half of people have read feedback about healthcare relevant to them online. This paper also went on to explore the question about why people share their feedback. And you can see the top 3 reasons here are to inform other patients, to praise the service, and to improve standards of care. So that's what people are trying to do typically. These are positive pro-social motivations to help staff to improve care for other people, to let other people know what the care is like. These inform, praise, improve motivations. We've found this in further surveys that we've done ourselves. For example, among patients in Northern Ireland, we've confirmed the exact same finding. The negative motivations are much lower. And interestingly, as part of this same research, the research team surveyed staff to find out how they feel about online feedback. And there's an overwhelming perception among clinical staff that most online feedback is negative. But in actual fact, that's not the case. Certainly in the UK, we find 70 to 80% of online feedback now is completely positive. So clinical perceptions of online feedback, particularly among doctors, are much more critical than is the case. So it may be, I think a lot of clinical staff's experience of online feedback is through unmoderated social media like Facebook. But if you come to a dedicated feedback platform like Care Opinion, their perceptions are completely wrong, and it's mainly positive feedback. And we need to think about why that matters. So this is a paper that I would recommend to everybody to read. I think this is one of the best papers that's been written so far about online feedback. This is from Fadila Mazandarani and other academics from Oxford University in the UK as part of the same nationally funded research that the previous paper came from. And this paper is called Caring for Care, and it's a paper which is based on interviews with around 40 people who shared feedback online, talking to them about their motivations and why they were doing that. And here are some of the illustrative quotes from that work, which I think are very instructive for our purposes. So the first one here, somebody says, I wanted to say thank you to the GP who'd been really, really good with me. And the way I did that was by emailing the practice manager and just saying, I've had this good experience, thank you. Because I was hoping, I guess, they could use that somehow with the regulator or something. So people are assuming that the feedback gets used, that it makes a difference, that it can be used by health service teams. Somebody says, I realize that, the NHS is under such huge demands, everything else, but unless we tell them what's wrong, they can't put things right. So again, this notion of people as critical friends wanting to support improvement in healthcare. And then somebody very explicitly saying, I firmly believe that in a subtle and perhaps longer term way, I'm contributing to change. So the picture we're getting here is of people posting their feedback, not simply to provide data, not simply to complain, not simply, as many health service staff believe, to sound off or to rant, but because they're trying to help, they're trying to change, they're trying to improve the service for everybody. So these are acts of solidarity and altruism and connection with health services and other health service users. But how does it feel from a staff perspective? So if that's what patients are trying to achieve, are they achieving it? And we have a little bit of evidence on this. We don't really have enough evidence yet in this area, but we have some early evidence. And this evidence this particular paper comes from the southwest of the UK, from a hospital that introduced Care Opinion. And this is an interview study with staff after the first year of implementation. And it's called Implementing Online Feedback in a Special Measures Acute Hospital. The hospital was struggling at the time and was under special measures with the regulator. And again, this paper showed that the feedback coming through Care Opinion has a significant and positive impact on staff. So there was a very positive picture painted. And as I recall, there were about 28 different impacts that the research noted. But this is one of the quotes in the paper that jumped out at me, and it's related to morale. So this is a clinical manager in an emergency department in the hospital. She says, I really love it. Working in the emergency department, you see a lot of terrible things happen. You see a lot of sick patients. So for me, it's such a refreshing change because we predominantly get positive feedback. It's just so nice to be able to cling on to that. I think it helps improve morale. It helps people's resilience as well to know there are actually some really grateful people out there. So this perception from staff who are receiving online feedback through Care Opinion is that actually it is making a difference for them. And there are other interesting quotes within this research around issues of staff pride in the service and confidence, people saying that they learned from using Care Opinion how better to talk to patients, how to deal with conflictual situations, and so on. So I found that a really positive and helpful paper. So let's have a look at a slightly less structured and slightly less rigorous data, which is Twitter. So a few things from tweets from that we've captured over the years, staff reacting to stories on Care Opinion. This is a nice one from a hospital in North London, Raki says, the team are loving the feedback and the ability to respond directly to service users. It's got us all hooked. And then here's a message from Lindy, who is a nurse in Scotland. She says, when I read this, I remember why I became a nurse. Thank you for appreciating us and what we do. And this is, I think, you know, this really illustrates how stories from patients can reconnect people with the values that took them into healthcare in the first place, reconnect them with their personal sense of mission and purpose in their roles. And I think that's a powerful thing for people. And here's another nurse in Scotland, Karen, saying, this brought me and many of the other team members in Ward 12 to tears. Great to know we've had such a positive impact on this family, but also important to note the positive impact their words have had on the team. So Karen here in this tweet, drawing attention to this notion of a virtuous circle, if you like, of good care leading to positive feedback and gratitude, and that flow of gratitude coming back into the team and having a positive impact then on the team, who can then go on to provide further good care. So this is the kind of virtuous feedback circle, if you like, that we're wanting to create and apparently are creating very often with Care Opinion, and that's what we're seeing. So there's a whole range of different things that people can learn from the feedback that people share. It's not just about, you know, food and parking, is it? There's plenty of richness in the stories that people share, and they're used very widely in education settings now in the UK. Many universities using Care Opinion in their curriculum. But these are some of the topics that you can learn about from reading and analysing stories. Patient experience and person-centred care, of course, we expect to be learning about that, but communication, empathy and compassion, ethical issues, quality improvement, leadership, how to respond to complaints, interprofessional learning, because you see the contribution of all team members, you see the importance of teamwork, good teamwork, and understanding what others are contributing to care, and digital professionalism too, which is an important issue for new healthcare staff, very often learning what can and can't be said online and how to remain professional in online settings. So these are many of some of the topics. There are many others, of course. And here's a quote that I like from Alex Clements. Alex is somebody who's been helping with the rollout of Care Opinion in a health service trust in the south of England. They've been using Care Opinion for about a year, and he presented at our spring conference this year, and he said Care Opinion has changed culture in a way which is soft, organic and relaxed, not corporate. And I really like that idea that actually it's a kind of culture change that creeps up on people, that we don't tell them how culture is going to change. We don't tell them how they have to behave or be different or think differently. The stories, the supply of gratitude, of insight, of authentic voice, whether positive or negative, leads people towards culture change. And just on that note, let me quickly mention a blog that came out yesterday from one of our subscribers, actually at the same trust. Let me just see if I can flip to this without breaking anything. This blog came out yesterday, and I'll post a link to this in the chat because it's particularly interesting, from Abby Barkham, talking about how patient narratives enhance understanding within healthcare teams. So I think you might enjoy that, and I'll pop that into the chat in a moment. So let's go back to the slides. Hopefully I haven't broken them. And just for my last slide, I'll mention a book that came out recently, again from an academic in Scotland, actually, from Ellen Stewart at the University of Strathclyde. She wrote a book about the complex relationship the citizens in the UK have with their health service, with the NHS. And as part of that, she included a chapter analysing stories from Care Opinion, looking at how people give feedback and what that tells us about their relationship with health services. And in that, she says, the analysis of patient narratives suggests a struggle between the desire on the one hand to protect and support the NHS, and on the other to share difficult, at times traumatic experiences of care in order to hopefully bring care, to improve care and bring about positive change. And she goes on, these are actively sought out opportunities to offer feedback as a gift to the NHS, and as such are not merely cultural but also political acts. So I think this sort of pins it down really, that people are trying to make interventions, and we can come back to this question later when we talk about some of the research. People are not just sharing data, they're not just giving their feedback and then forgetting all about it. What they're doing on care opinion is very often giving feedback to create change, to make an intervention, to encourage staff, to help improve the quality and safety of care. So I'll stop there, and hopefully that's been helpful. And if there's any questions or time for questions at this point, we can pick a few up, or we can do that after Fraser's talk.
Happy to take some questions now, James, if anyone has anything that they'd like to pop into the chat there. Thank you very much for a great overview. There's always so much happening. See anything in the chat
I'll put the
there?
link to that blog I mentioned into the chat as well, just so that people have it in case you want to have a look at that afterwards.
Sorry, I've got something.
Claire's got a hand up.
Great. Thanks, Claire.
Thank you, James. I wondered, I've really been excited to watch how care opinion has really been embraced by different bits of the NHS, including, for example, medical education. I wonder if have you got any anything that you can say about how, so here in Western Australia, certainly, many of our health services have what are called consumer advisory councils, or committees of patients or service users who are part of the governance structure and provide advice and work in partnership with the health service providers. And I wondered if there's anything similar in the UK, and how, if you know of anything of how care opinion is being used by that group as a, if you like, as an extra lever for that partnership as partners of improvement.
Yeah, great question. And the answer is a little bit unclear, really. I mean, we do have very similar bodies in the different health systems of the UK. So, for example, in England, we have something called Local Health Watch. They're typically at local authority or council area across England. In Scotland, there used to be health councils. Fraser can bring me up to date on what they have now, I'm not quite sure. And in Northern Ireland, for example, there's something called the Patient and Client Council. So there are different, if you like, consumer kind of advisory and input bodies in different parts of the UK. Their relationship with care opinion has been slightly uncertain, I think, over the years. So, for example, in England, which is the bit I probably know the most, some health watches have, as you suggest, have sort of embraced care opinion quite enthusiastically and used it to seek feedback and to collect feedback and to create reports and so on, and fed them into the local health system. Others have, in a sense, felt that we've been treading on their toes, that actually it's their job to do this kind of feedback and collect stories and so on, and that we're some sort of interloper getting in the way and, sort of getting into their territory, really. So some have been a little bit more antagonistic. More broadly, I mean, the national patient groups and national patient charities, it's been a similar thing. Some have enthusiastically embraced care opinion and used it in all kinds of ways for local and national campaigning and pushing for certain policy changes. And others have sort of tried sometimes, or thought, can we fit this in, and then haven't really found a way to fit it into the things that they're interested in. So it hasn't been a sort of uniformly successful relationship. It's been quite uneven in different places, and I think it depends a little bit on people's attitudes to working with others in the sector, really.
Great, thank you.
Thanks, James. Let's see if we got any. I've got another couple of questions in the chat here. There's a question here from Aurora wondering if there are ways to moderate stories shared on the Care Opinion platform, or we can talk about that, particularly for complex feedback requiring more investigation or staff management or nuance. Perhaps we can keep that one. We can have a little bit of a chat about that at the end, perhaps. How do we expose staff to include all, including sometimes severely negative feedback, in a responsible way? Did you want to comment to that, James? We're talking about some pretty serious feedback there.
Yeah, that's right. So all feedback coming through Care Opinion is moderated. It's moderated by humans, not by machines. So that's done very carefully. Sometimes it raises important legal or safeguarding issues. We have to address those issues of defamation and so on. We do it in a way that means that we try to minimise harm for everybody concerned. So to keep patients and carers safe, to keep staff safe, everybody needs to be kept safe, so that, like anything in healthcare, like any intervention, we want to maximise the benefits and minimise the risks, don't we? So it's exactly the same with healthcare as it would be with a new drug, that we have to focus on how do we get the benefits, but without causing any bad side effects for people. And that's really important. We spend a lot of time thinking about that.
Thanks, James. We've got a question there from Karen, which I can follow up with afterwards, Karen, in regards to your question. In terms of what we're doing, that's why we're all here today. The Care Opinion Australia platform is the little brother or sister or sibling of Care Opinion UK. We're a bit younger. We've only been going for 12 years, but we look up to our big sib to give us the straight dupe on how to get it done. So we work in partnership closely. So we can follow up with you afterwards there, Karen, in terms of what we do in Australia. And we'll hear some more from our colleagues in just a little while. Lovely comment there. Southeast Sydney been using it since 2015-16. We love that. They're one of our longest serving subscribers, and we'll be hearing from some of your colleagues this afternoon. James, if you were starting again, what would be your key piece of advice for someone starting on the journey?
Well, that's a slightly ambiguous question. If I was starting again running Care Opinion, or if somebody was starting again using Care Opinion, that would be a slightly different thing. I think if I was starting again with Care Opinion, I mean, there are various things that we've designed that I think we've probably got slightly wrong and that we're trying to fix as we go along. I probably want much more funding behind me before I started. But we have, of course, on all journeys, you learn an enormous amount as you go. And so you are constantly making improvements. In terms of people starting to use Care Opinion, I would say dip a toe in the water, try it out. Don't expect to go too far too fast. It's a very incremental and learning process for everybody, I think. This is a new way to do feedback that's unfamiliar to people, a bit scary. Many clinical staff start off being very scared of the idea of open online feedback. You don't have to do it as a big bang all at once. Build it up slowly. Start with your enthusiasts, early adopters, and spread out from there. And you'll learn as you go. And that's the approach we're taking in the UK, and it's working really well.
Thanks, James. Thank you all for putting your comments and questions in here. I think we've got one more here from Tanya, just a last comment. I think it would be a great addition to disability services. Would love to be something just the NDIS providers had to sign up to. Tanya, we absolutely agree. We've been trying to engage in that space, and I expect that we'll see some inroads there soon.
Wonderful. Thanks very much, Alicia, facilitating some of those questions. We got a couple in, and we'll have time hopefully at the end of the session for some more questions. Thanks so much again, James, for sharing your experience, the research findings, the thought-provoking insights from years of experience. We really appreciate your accompaniment and the support of the Australian journey. As always, you're very generous, and we very much value this relationship and learning from you.